Yes guys, so today we're going to talk about how I treat a lot of my weightlifters with knee pain. So one of the most important things to start off with is load management. How much training volume you're doing and how intense your workouts are throughout the week, and also week to week and month to month, how much you increasing volume and intensity by, because that has a massive impact on injuries and especially knee pain. If you've been squatting a lot or you've been doing a lot of heavy cleans, and then you've bumped your volume up by more than 10% between week to week or month to month, it could be a major cause of your knee pain. So to combat that, it's fairly simple. It's either reducing the volume of that painful movement, so for example the squat, completely stopping it if the pain is really severe or irritable, or making a simple exercise modification to the back squat, for example, to a box squat. So if you could do that within a 3 to 4 out of 10 pain score, that would be really good. But again, really irritable, completely stop, a little bit irritable, carry on back squatting, and then somewhere in the middle we'd chuck in an exercise modification like the box squat. So after we've nailed the load management, then what I would start to think about is getting some really good contractions around the knee joint. So obviously the quad, but then also at the calves and at the hamstrings where they cross over the knee joint. So some really good exercises for this that I use with a lot of clients is split squat hold variations. So the floating split squat hold variation is quite a good one to start off with, and then I would usually progress this by going into a normal split squat hold, so completely on the floor, and then I progress this by adding some sort of weight. Another really good way to get the calves going is a floating split stance hold with a calf raise added in. Again, for the hamstrings, loads of hamstring bridges, so double leg, single leg. You can progress these by going from double leg to single leg and then going on to a foam roller. And then another aspect of knee rehab with weightlifters is improving their tolerance to knee extension, which is straightening the knee, and then knee flexion, which is bending the knee. So one of the simplest ways to do this is a single leg squat, starting off to a high box and then gradually decreasing the height of that box, and then adding weight as well to make this a little bit more difficult. Another really important aspect of knee rehab with weightlifters is improving their single leg strength. So once they can tolerate that knee flexion and extension to a decent range, we can start to include things like elevated reverse lunges, split squat variations, single leg workout machines, so single leg quad extensions, single leg hamstring curls, anything where we can target either side with a bit more intent. Also, another big aspect of the knee rehab is improving hip control. So I normally add these in with warm-ups. So it's things like the 90-90 hip shift, the hip lock, so starting off with the supported variation, then unsupported, and then going on to a bit of height. And I'm also a big fan of staggered stance movements in the warm-up. So things like a staggered stance hip hinge, kickstand chop, where you're getting some rotation through the hip as well. Just getting it moving before we go into our more specific stuff around the knee. And then moving into sort of mid to late stage rehab, I'll add in some plyometrics, again, improving their tolerance to higher loads. So really basic stuff. So things like a double leg pogo jump, and then going into a single leg pogo jump. And then you can add in more complex stuff like box jumps, depth jumps, etc. Once we've got into the later stages of rehab, it will be a case of testing their normal training volume and intensity with, your normal exercises, so your snatches, clean jerks, back squats, front squats, and seeing how we respond. And then alongside that, also adding in just some prehab work. Now, this isn't going to stop you getting injured, but it's just stuff that weightlifters normally neglect. So typically isometric holds, single leg work, strength stuff with an emphasis on the hamstrings and calves. It's not going to stop you getting injured. The main thing that's going to prevent the injury, again, is the load management. So when you finish rehab and you get back to training, don't go straight back into that old mindset of thinking I can jump from week to week by loads of volume, a lot of intensity. I can test my 1 rep max whenever. Slow, steady progression is the name of the game, and it will reduce your injury risk and provide you with the best results in the long term.